stuff like that.
And Maureen, talk a little bit more about the other services that are available. As we mentioned earlier, it's not a walk-in clinic, and there is a process you have to go through to be seen, and we'll talk about that in a minute. But talk about the basic services that are provided by the clinic, besides dental.
Basically, the physicians see patients with the chronic healthcare problems, hypertension, chronic obstructive pulmonary disease. They may have heart disease, cardiac arrhythmias,
Diabetes.
asthma, diabetes, and the general kind of illnesses that create long-term effects. We have patients with obesity, and all of these diagnoses, if they are managed, can really be treated well, and that will limit the patient's complications. I mean, hypertension can lead to stroke if it's not treated. And we all know diabetes can have terrible consequences, complications. So really, by having a place to come with these chronic illnesses, the patients really are not just getting treatment, but they are also getting educated on how to take care of themselves.
That's the other thing that, as I looked at the website, I noticed that there's really an educational component too. It's not just the treatment, but it's helping these people understand what they can do for themselves to improve their own medical situations, and educating them how to do that. Are a lot of your patients people that have just neglected their health care for a long time just because they couldn't afford it, and now they're trying to get back on track to manage their chronic conditions?
Yes, it's really a shame when you think about the country we live in, and how some of these people have what would be considered fairly minor or treatable illnesses, that they have not really had the resources to see a physician, and so their situations have worsened. So by being able to come to the clinic, they've really been given a second chance at life, and their health has improved greatly. And as Beverly was saying, with their dental care, that can make a big difference in a person's general health. And I'd like to add that we've recently added mental health services, which is a big part of the problem in our community as far as anxiety, depression, and we know that untreatable mental health issues can lead to substance abuse, which is a very big part of the problem in our community. And we have to realize that these problems are a community problem. What affects the person's health affects the entire community. So we all really need to be involved in, helping out any way we can, any small way we can. It's very important. I'd like to mention too, I don't know if you weren't part of the clinic, and I don't think I was aware of it in the beginning, but Dr. Augustiniak was the dentist in town that was treating the Crescent Community Clinic
in his
patients
office.
In his office. So he really did step up, and he was very good and generous about treating patients.
So how many chairs do you have at the clinic for dental operatories?
For dental, we have 3. Right now, we have 1 X-ray unit that we're using. So we more or less have to take an X-ray and triage it out to the other room. Some of the materials that we have in our equipment is a little bit antiquated with what we're used to in a regular private office, but we make it work, and we do what we have to do.
Do you have any specialists that are involved that volunteer with the clinic?
When a patient comes in, and of course the more patients that we see, the more pathology that the physicians are picking up on. So patients may come in with a hernia that they've had for quite a long time. It may not be an emergency at that time, they've lived with it a long time, but if the service is available, we do have surgeons that work with the clinic. We do have ENT specialists, we have plastic surgeons. We do have a wonderful group of community specialists that we can call upon, and they've been very generous in their pro bono service. But we always need more because the patient load is just increasing, every week. And so
I can imagine there's just all kinds of things that you need for an operation like this. You need supplies, you need helping hands, you need donations. There's just a lot of things. What would you say, someone watching this, what would be something that someone could do to help the clinic if they wanted to get involved and help it succeed or help it grow?
Well, we are having a fundraiser and a yard sale fundraiser. We did have a tea fundraiser, so if you can help support our fundraisers, we have a website, and www.crescentclinic.org, and there's information on the website. We have a Facebook page, and there's always ways that anyone in the community can call us. We developed Friends of the Crescent Clinic, which is our volunteer organization of communities, people that do come and help us when we call upon them. We don't always need people to come to the clinic and help because we do have a staff, but we need people to write press for us. We need them also to go out and spread the word of the clinic, have fundraisers for us in their communities, whether it's a bake sale or just a car wash or any small way of them giving us some help. Yes.
Now, what is your capacity? You're director of community development, right? Is that?
Yes, I'm the director of development, which means I go out to recruit physicians, healthcare professionals,
and you're a volunteer.
Volunteers, and I'm a volunteer there also.
Okay.
And I also would like to talk about the area hospitals. They have been wonderful, giving us the services that we need. Oak Hill Hospital, Brooksville Regional, Spring Hill, and the outpatient surgery clinics here have been wonderful. Brooksville Regional sends a lab tech every Saturday that the clinic's open to draw labs, and they do all the blood work for us pro bono. So we really have had a wonderful partnership with our area hospitals.
It takes everybody's cooperation because obviously if someone has a condition that they have to be hospitalized for, have surgery for, then the hospital participates and cooperates by not charging for those services, right? Okay.
That's right.
And Bev, you are, what is your title?
Dental coordinator.
Dental coordinator. So that's your specialty, is the dental aspect of the clinic, both of you being volunteers.
Right.
How many volunteers would you say are involved with the clinic, considering all the doctors and everyone who helps with it?
Oh, I would say probably we have over 35 physicians. We probably have 25 nurses and nurse practitioners, physician assistants, and probably at least 100 Friends of the Crescent Clinic.
Okay, and probably growing all the time,
yes,
right?
Yes.
And talk a little bit about the process. First of all, eligibility. What makes someone eligible to be able to use the clinic services?
Well, we have all of the eligibility requirements on the website, but basically you have to be a low-income, person or part of a low-income family, and you have to have, no insurance and be 18 to 64 because
no insurance or underinsured.
No insurance.
No insurance.
No
okay.
insurance. Yes.
Oh, and the age is very important. You don't see children, right?
No children.
18 to 64.
Right, because the children usually are covered by Kids First, and I think they can also go to the health department. So we just do the 18 to 64 age group.
Okay.
Yes.
Okay, and what's the process? Someone can't just show up at the clinic and expect to be served, right?
Right. We are not a walk-in clinic. We're not an emergency clinic. Basically, the individual can go to the website and print off an eligibility application and either mail that in, drop it off, or email it back to the clinic, where a clinic staff person will review the eligibility and contact the person and set up an appointment for them.
Okay. All right. Well, we have a video that is a testimonial of 3 patients who have used the services of the clinic. Bev, would you like to set this up a little bit and talk about what we're going to see as far as the video?
Well, today we're going to see 3 patients that were seen at the clinic with 3 different incidents or whatever, and each one's telling how the Crescent Clinic helped them and really did a great job of saving their lives. So,
and we'll also see Barbara Swinberg at the end.
Swinberg,
talk a little bit about Barbara. What is her role at the clinic?
Barbara is the director of services. And basically she's the one that runs everything. She's kind of the glue that keeps it together and is there every day with the volunteers, with the patients, with the doctors. She's the glue that holds it together.
Now, is it open every day? Does it serve patients every day, or is it certain days of the week?
It's open every day, But the thing is that there's certain days that they will see clinic patients, medical patients, which is the first 3 Saturdays of every month, or on a Wednesday mostly if there's a physician. Mondays they do see mental health patients.
So that's why it's important to fill out the paperwork, and then they will
Absolutely.
schedule you based on when
Absolutely.
they have physicians available.
Yes.
Because there's such a need.
Right.
Dental patients we see whenever there's a dentist that will volunteer their time, or a hygienist. So it could be a Monday, Tuesday, Wednesday, Thursday, or Friday. We try to keep it away from Saturdays when the medical clinic is there.
Okay.
But there is a list and it's growing, and so that's where we really need more and more people coming in so we can make it available for more days of the week.
Okay. Well, let's roll the video
Okay.
and hear what these testimonials have to say.